Hi, this is Congressman Dr. Ami Bera, your representative in Congress. Thank you for joining my live telephone town hall this evening. I know a number of you, we've had hundreds of folks already dial in and call in, but we are calling out to about 50,000 households this evening. So we will start getting to questions shortly. The goal of tonight's town hall is really to talk about this unprecedented pandemic that is really impacting not just our community, but our entire country, as well as the entire planet. And to give you the latest of what we're seeing from the healthcare side, but also to weigh in and talk about some of the relief for workers. We understand lots of people have been laid off, small businesses, et cetera, and how we can keep our community intact and our country intact and try to safely get out of this without going into a depression. And this is unprecedented. We've never seen anything like this. Again, if you're joining my telephone town hall, this is Congressman Ami Bera, Dr. Bera. If you have a question and you'd like to ask us a question, go ahead and press 0 at any time, and you'll be joined in. In addition, as we go through the big stimulus bill, which is now the third bill that we've passed to help the American people and American small businesses and companies, one of the best ways to keep updated on that is to join our email list. And if you're not on our email list, if you press the number 5, my staff will continually be updating that information and sending it out via the email list in terms of where you can go for resources, what agencies, what you can do online, et cetera, and what's available in this bill for relief. So that's 5 to join our email list. You can also go to our website where we have a COVID-19 community resource guide that we're constantly updating with new information, and that website is BERA, BERA.house.gov. We are going to start taking the first questions in a few minutes. Again, I'm pleased to be joined once again by Dr. Peter Bielenson, who's Sacramento County's public health officer, also Heather Luzzi of the Small Business Administration, and Dr. Richard Pan, who is also our California State Senate representative, who also is a physician and pediatrician. So we are starting to get some questions, but what I thought I would do is give a little overview of where we are as a nation, maybe a little bit of background of how we got here, and then from the federal level, how we are thinking about this unprecedented pandemic. I will then kick it over to Dr. Bielenson to kind of frame what we're seeing here at the local level, and how do we see a wave coming at us? If we do, when do we see that wave, et cetera? And then we will open it up and start answering some questions. So hang in there. We're going to go through a lot of information on the front end, which hopefully will cover a lot of the questions that folks have. And we'll talk about the healthcare side on the front end. And then I think on the back end, we'll talk about the resources. We have Heather Luzzi from the Small Business Administration, how small businesses can get help. And I'll also try to answer some questions of how we can get help for folks. So again, if you have a question for us, press 0 to ask a question at any time, and we will try to get through as many questions as we can. And if you really just want information, again, press 5 and you'll be joined on our email list, and we will send out that resource guide and additional information as we get it. So if we think about, where we are, we're in really the end of month 3 of this pandemic. In early January, you started to hear, stories coming out of Wuhan, China, about this new novel coronavirus. We've had coronaviruses before, but this, when you hear people say novel coronavirus, really what they're saying is this was a new strain of that coronavirus. We, certainly were worried and concerned in early January, and then around the second week of January, you saw a city of 15 million people go on quarantine and lockdown, and that's when we really started to get very concerned that this wasn't just a new virus. This was one that probably was spreading fairly rapidly. Around January 23rd, we had the first briefing from the administration, and everyone knows who Tony Fauci is now, and I know Dr. Fauci fairly well. We've worked together for a long time. He, along with others, briefed us on what they were seeing. That was around the time the president instituted the travel ban to try to contain the virus over in China. But I think to many of us, we knew we wouldn't be able to contain the virus in China, but what that would do is hopefully buy us time. And the hope was that time would give us some time to prepare, get our public health systems in place, get testing capabilities, et cetera, in place. You started to see the virus pop up in other places, Hong Kong, Korea, Singapore, Japan, mostly in Asia, but we had our first cases popping up in Seattle in January as well. So, that brings us to February when, the initial test that was developed by the CDC, and we were told that was going to get pushed out to the county public health labs in all 50 states, unfortunately, was not as reliable and accurate. And I think that was one of the first mistakes that was made, is not getting those testing supplies out fairly quickly. I'm not going to lay blame anywhere, but I do think that led us to where we were in early March, when here in our backyard in Sacramento County, and you had a case from Solano County that got transferred up to UC Davis. This was a patient on a ventilator who ultimately tested positive for COVID-19, and it was the first known community-acquired case of COVID-19 where this wasn't someone who had traveled abroad. This wasn't someone who had come in contact with a COVID-19 positive case. This was someone who we have no idea how she acquired it. Fortunately, she has recovered, has returned home through great work at UC Davis and with the healthcare team there. But that's when we started to change the testing requirements. We started to try to, continue to ramp up the need for broader testing in the community, et cetera. If you look at our governor, our local mayors, Dr. Bielenson, they very early on sounded the alarm with initially social distancing, and then voluntary stay at home, and then mandatory stay at home except for non-essential activities. I actually think that their early actions and their quick actions have really bent the curve. If you had a chance to watch the president's briefing today, you saw Dr. Fauci and Dr. Birx kind of going through what's happening in New York and New Jersey. But then she specifically pointed out Washington State that had the early outbreak at the nursing home, as well as California. And if you look at the curve on the charts that they were using at the briefing, ours are very different than, this exponential growth that you're seeing in New York and New Jersey. That's not to say that we won't see that, but I do think the early social distancing, the early stay-at-home orders may have certainly has given us time to get prepared, to have the hospitals create capacity, to think about the worst-case scenario, whether we have to use Arco Arena or something else as a secondary ancillary facility, and get us prepared. So, I'll let Dr. Bielenson talk a little bit about that. Let me talk about what's happening at the federal level and how we're thinking about this. I am, thrilled that the president is listening to the doctors on his task force. Both Dr. Birx and Dr. Fauci are very smart, credible, and really understand what we need to do. And the president is doing the right thing by keeping the stay-at-home order in through the end of April. Where we are now is we still have to get the protective equipment out to the healthcare professionals. These men and women, the nurses, the doctors, the first responders, they're our heroes right now because they're putting their livelihood and themselves at risk. And, I'd like to see the president continue to use the full authorities of his power to compel companies as quickly as possible to get that equipment out to where it's needed, to have a command control structure at the federal level so you're distributing the equipment to those hot spots that are underwater right now. So it's not 50 governors competing against one another for the same limited supply, because we're also competing with the rest of the world right now. So that command control structure is absolutely essential, and we've communicated that to the administration. Number two, we still have to ramp up and get diagnostic testing capabilities out there. That is increasing. You know, you hear about this Abbott lab test that will be a point-of-service test where the doctor can actually get results within minutes, you know, as opposed to days. And I think that's absolutely necessary if we want to get ahead of identifying who has the disease and who doesn't. You know, I'm glad that the governor is extending the stay-at-home order for the state. And, you know, again, I'll let Dr. Beilenson talk to that. But we have to see where this curve is in the next week, 2 weeks, 3 weeks, 4 weeks, and use the data and the science to guide us in making sure when is it safe to start reopening portions of our community and portions of our country. The things that we're thinking about now, and I'll finish this, is you will start hearing people talk about a different type of test, a test that's called serology. And what that test is to test whether a person had the virus, recovered, never showed any symptoms, and now has some level of immunity. The reason why that is important is that person is going to have some level of protection. We're now, we do have that test. We're allocating the resources to really commercialize and ramp that testing up, and we are starting to think about, you know, how would we go out and get a sense of how prevalent the virus is in our community, so it is now safe for some folks to start returning to work, et cetera, and they're not at risk to others, or it's safe for healthcare professionals to go out there and care for folks. We also know that, you know, you'll hear people talking about whether, as we return to work, and there's still folks that are high risk, whether folks should have cloth face masks, not the N95 ones, but face masks to prevent a second surge of infection. You know, I do think that is probably a pretty good idea. So those are the things we're starting to think about are the what next. At the same time, and we'll talk about this in the second half, we passed this big stimulus bill knowing that we have to get relief as quickly as possible out to workers who have been laid off, workers whose hours have been cut, folks that are going to have trouble paying their rent, you know, small businesses that may have already closed their doors, and I will talk about that shortly when we get to the questions. But you know, that there's a real human toll here, and we're all in this together, and we're going to have to look out for one another. And we very much understand that at the federal level, that we've got to get that relief into people's pockets very quickly. Let me kick it over to Dr. Beilenson. If you want to just cover introduce yourself, and then just cover, you know, the local response. Peter, you're on.
Thank you very much, Congressman, and hello to everybody. I'm Dr. Peter Beilenson. I'm the director of the Sacramento County Department of Health Services. As of today, we have 300 cases exactly, 8 deaths. So it's about a 2% mortality rate. But as you're probably well aware, this is because in large part we've been doing a bit more testing than we had been. We had been doing 50 tests a day up until about a week and a half ago. A week ago, we're now doing probably 300 or 400 a day, maybe 500 a day. So we're identifying more people. We, as the Congressman was talking about, the two biggest issues that we have facing us right now are adequate number of test kits. Even though we're doing a few hundred tests a day, we could certainly be doing thousands a day, and that is vital to both know what percentage of people in Sacramento County are affected, as well as helping people get the appropriate type of treatment. And the second thing that we really need is the PPE, the personal protective equipment, PPE, i.e. N95 masks and gowns that our medical people need to see before they see patients, and they're burning through them at large rate, and it's very important that we have that PPE available. I will point out also that the Congressman was talking about sera. and finding out who has antibodies. And one of the potentially promising modes of treatment is actually to use convalescent serum, which is simply the plasma of people who have recovered from this virus already and have antibodies that could then work against the virus in other people. And so that's a promising potential treatment that's being looked at. But if I could just finish by saying that California has been doing quite a good job at flattening the curve. They have been very good at staying in place, and if we can just reduce the amount of social contact by a few percent more, we can make a truly big difference in terms of saving the medical system from being overwhelmed. And that's it.
Peter, thank you for that. If
you
have
hear
a
that?
question, I did. So if you have a question, go ahead and press 0 at any time. And if you'd like to get email updates on as this evolves, go ahead and press 5. Let's take a couple questions, and I will kick it over to. Yeah.
Oh, did you want me to say something? Oh, this is Dr. Pan.
Oh, hey, Richard, go ahead and if you want to talk about the state approach.
Yes. No. Thank you so much. And again, Congressman Bera, I want to thank you for your leadership. We certainly could use the federal help to help many people who are in need. I know we're going to touch on that later in the call. I also want to thank Dr. Bielenson for your leadership here locally. So at the state level, we've been working hard to be sure that we have the stretch capacity to address this pandemic. The good news, as Dr. Bielenson said, is that because we've acted early, we are slowing the spread of this disease. So that means people are staying home. People are washing their hands. They're not touching their face. When they're sick, they're staying home. This is so extremely important. We see what's happening in New York City right now, where the hospitals are full and overrun. When we see how fast the disease is spreading in places like New Orleans, Chicago, Detroit, other cities, and then when we look here in California, we are going to have a wave of people who end up needing care, and but because of the things that we've done, that is not going to be as large as in those other cities. But we need to continue doing that. That's so very important that we do not let up in what I call physical distancing in terms of being sure that we slow the spread of this disease. But I think we are cautiously optimistic that we are going to be able to get through this without having people who might end up dying because they couldn't get medical care because the hospital was full and there's no ventilators. Now, at the same time, we are still working to get more because we will probably end up having to stretch a little bit to make sure this happens. So the governor has said that he's looking, we need to get 50,000 more hospital beds, probably nailed down many of those, but we're continuing to work on that. We are also trying to greatly expand testing, which is going to be very important so we can better focus our efforts. We are trying to, working to get the PPE. And again, I want to thank Congressman Bera for your leadership. We do need federal action. As you said, the president needs to take leadership in trying to get the personal protective equipment to not only our healthcare personnel who are working in our hospitals and our clinic, but our first responders out in the field, and many other people working in our nursing homes and other facilities as well, where we need to, try to protect the employees, but not only protect them, but prevent them from then infecting other people who are the patients or the people who are being cared for. So I want to, again, thank you so much, Congressman Bera, for your leadership, and look forward to helping you answer any questions that come up, particularly in relation to the state.
Great. Thanks, Richard. Again, let's go to some questions now. If you have a question, press 0 at any time. If you want to email us or go to my website, you can go to bera.house.gov. We've got a question from Simi in Sacramento. Simi, you're on.
Hi, thank you for taking my question. My question is, what would you guys recommend to healthcare workers and senior adults who are living in residential care facilities for the elderly? Primarily focuses on independent living level of care, since this is the targeted population that is most vulnerable due to their age and their pre-medical conditions. Are these facilities being given enough attention to ensure necessary PPE is available? And what is your message to the loved ones who are family members of these senior adults who are not able to visit their loved ones, which can trigger psychological symptoms for either both of the parties who are not allowed to visit people in these care facilities where they were providing a very pertinent daily activities?
Yeah. That's a great question. That's part of the human toll. We know that this is a particularly vulnerable population. If you look at, data coming out of New York, data coming out of Italy and elsewhere, it is really those folks over 60, but particular folks over 70 or 80 that are being hit incredibly hard. Peter, do you want to talk about specific ordinance that the county has put in place with regards to nursing homes and workers? And Peter, you might be on mute, so if you want.
Sorry, did you call me?
Yeah, Peter, the question was around the specific vulnerabilities of the nursing home population and the workers in that population. If the counties put out specific guidance.
Yes, so they are obviously at significant. The people who live in these senior homes are at significant danger from the virus. We're fortunate so far, as far as I know, that we've only had 2 cases related to that one senior living place in Elk Grove. That being the case, we have very strict guidelines for visiting senior centers, and in fact, most senior centers now don't allow visitors at all, and they require their staff to be fever tested and wear masks when they come in. So we have pretty strict guidelines, and we have not had to put out any kind of specific order because people have been following it.
Thanks, Peter.
This is Richard Pan. First of all, I very sympathetic to the challenges, Simi, that you shared. We are trying to protect our seniors, hence orders to try to limit visitation or actually stop visitation. I know the state is prioritizing testing seniors with the testing that we do have. So understanding that we have our testing capacity still needs to grow, but we are prioritizing testing particularly seniors and healthcare workers. And then in terms of the PPE, we need to work harder to try to get more PPE to the people who work with our seniors and they're in the nursing homes and assisted living facilities and so forth. So we do need to try to figure out how to ramp up our PPE production and also distribution. I think one of the challenges here is that given what's happening in some of the other parts of the country and the demand for PPE there, certainly people could say, who prioritizes what, right? And I know that we've had locally, whether it's facilities or other entities ordering PPE to find out those PPE orders are not being fulfilled because they've been taken and prioritized for other places.
Right. I would follow up with what Dr. Pan was just saying. I literally just got a text saying we have to apply for 100,000 additional masks because they weren't available. So it's a continued issue.
Great. Let's get to another question. We've got Susan from Carmichael. Susan, you're on. Susan.
Yes. Good evening, everyone. My question is in regards to a statement that was made to me by the Sacramento Sheriff's Department that they are not enforcing the stay-at-home orders from the governor's office because in their mind it may cause panic. And the question really goes to what happens to the homeless population? What measures are being taken? No one seems to want to answer that question.
So I'll take a stab at that.
Go for it, Peter.
And I'll take another stab after you.
Okay, sorry. So we have a significant effort ongoing to deal with the homeless, both the sheltered and those who live in the encampments. Those living in the encampments, ironically enough, are actually in a little bit safer setting because they can be spread out and there's smaller numbers of them. We have porta potties with sinks coming this week, starting this week, and next week we've already put out hand sanitizer on the riverbanks and to other homeless folks around town. So that's how we're dealing with the encampment folks. With the shelter folks, we will, as well as encampment folks, anybody that has symptoms of the virus, i.e. fever, cough, and shortness of breath, will be isolated in rooms, and we have motels for that purpose. So we have about 800 motel rooms and 200 other rooms. So we have about 1,000 beds available for isolation where people can stay for up to 2 weeks.
Great. And Peter, Richard, I know the governor has also really been pushing for more hotel room access, and I know Mayor Steinberg's been looking at other solutions like some of the dormitory space.
Exactly. Before the legislature went to recess, we approved $1.1 billion in coronavirus response funding, and some of that, actually several hundred million, are dedicated to securing basically hotels, rooms, motel rooms, other types of sites to house people who are homeless, particularly who are affected by COVID-19, so that we can try to provide isolation and treatment for them as well. So there is considerable activity going on, as was mentioned locally here. I know Mayor Steinberg and many other local leaders have been working as well to address the needs of the homeless population and to ensure that that does not become another locus for spread of this disease, so that everyone can practice the what you call physical distancing, because we need to socially connect, and also that they're in facilities where they have plumbing and can wash their hands and do all the things every one of us need to do to prevent the spread of this disease.
Congressman, could I take a stab at one other further thing as well?
Sure, go ahead.
So to what you were asking about the Sheriff's Department not responding, actually we have 311 that's got about 1,000 calls in the last week and a half of both what are essential versus non-essential businesses and when non-essential businesses are still being left open. And so we have collated them and we have handed them over to our code enforcement to actually go out and visit places that are not behaving or being good actors, if you will. So we are addressing that.
Great. And I'll close and we'll get to the next question. But in this last bill, we also allocated $4 billion to help communities with the homeless. And that was something that we championed and worked to get in there. Let's go to the next question. We've got a question from Kathy. Kathy, you're on.
Hello. Yes.
Hi, Kathy.
Hi. My question is that I am curious. I have two questions. How long should someone isolate after being exposed or possibly exposed?
2 weeks.
Great.
2 weeks?
Yeah.
Okay, and so regarding testing, there's so much different information. And so on the Sacramento County statement on mitigation, it said there's a minimum value in testing people who have no symptoms since treatment is only based on symptoms. So is that still what you guys are saying?
That was actually at the very beginning of the outbreak when we turned to mitigation from containment, which was mitigation was trying to protect those who were most at risk. And because at the time it did not appear that people who were asymptomatic were actually sick, and there was a very limited number of tests, that was what we were saying. I should make sure, of course, that it's actually changed because we're more up to date now. But the bottom line is if someone tests positive or someone is presumed positive because of their symptoms, you need to self-quarantine for 2 weeks.
Great. Let's so we're about halfway through this call, and we'll sprinkle in some healthcare questions additionally. But I know we're joined by Heather Luzzi of the Small Business Administration. She represents our region. And Heather, if you want to talk a little bit about some of the relief that is out there for small businesses that have been hit hard, and I certainly can talk about some of the relief that we're trying to put in there for workers and the large number of people that right now are being unemployed. And then we'll take a few of those questions. Heather, let me give you the floor.
Thanks so much, Congressman. It's my pleasure to address you all tonight. My Sacramento District office actually covers the 22 northeastern counties of the state, including Congressman Bera's District 7. So with the SBA, we're located actually right here in Citrus Heights. We're very local. We have actually all of the processing that is done for the entire country is done out of our office for our 504 loan program and our 7A loan program. And those are just parts of the Small Business Act. With our disaster assistance, and that's really what we're going to talk about tonight, the disaster assistance is based on the economic injury that we're in the midst of right now. The economy, because of this COVID-19 coronavirus, has really come to a standstill. You see that all businesses are closed, or most of them are closed. Hit especially hard is our restaurant industry. If you can go get food to go, please go do that, and support those businesses. But with the SBA, one of the components of what we do is to assist during times of disaster. And with that, it's typically a disaster such as the Northern California fires that we dealt with at the end of 2018. Those are typically isolated to a geography or geographic region, and then we come in and assist FEMA, most likely. In this instance, SBA has been put in the position of a first responder, and this is a first for us. We have not had a disaster of this magnitude. And keep in mind that, of course, this encompasses the entire U.S., all of the territories, as well as the world. So the magnitude is really enormous. With the small staff that we have, we are doing our best to get through those economic injury disaster loans that SBA is offering. So we've been processing those for a couple of weeks now. Had a couple of hiccups along the way, simply because we're not used to the amount of volume that is coming through the channels. Our website last Tuesday, a week ago today, hit 4 million hits and crashed. We have since shored that back up. We have looked to private sector partnerships to address customer service issues with our call center because people were being placed on hold or calling in and being made to hold for sometimes 2 hours or more. We have, again, partnered with private sector industry to fill those gaps. So now we have a call center that is open 24 hours a day, 7 days a week. It's a two-tier system, so the first line will assist as far as general questions. As it gets more in-depth, then it'll go to a second or senior person to address. The website has changed substantially as well. So that was actually brought down over the weekend. We brought it back up yesterday. It's working very seamlessly. And again, it's a private sector partnership that the federal government entered into because of where we're at. Really just unprecedented times. With the CARES Act that was signed into law on Friday, the agency, or the Small Business Administration, was allocated $349 billion in loan guarantees for this pandemic to assist the small businesses within the U.S., try to shore them up and get them back on their feet so that they're not in danger of closing. With that said, keeping in mind that in a typical year, the SBA would generate anywhere from say 25 to 27 billion in loan guarantees. So this is a huge increase from that. Within the CARES Act as well, our resource partners, which are kind of the way that SBA looks at this, would be our boots on the ground. We have our small business development centers, our women's business centers, our Veterans Business Outreach Centers, and our SCORE partners. Those will additionally get funding through this CARES Act. With the programs that have come online, as I stated, the Economic Injury Disaster Loan has already been up and running. This week we will be launching another program called the Payroll Protection Program. And that is a program that can actually go up to $10 million and can help companies to bring back employees, and a portion of that will be forgivable. With the current loan, the Economic Injury Disaster Loan, those go up to $2 million, and there is a component that borrowers or small businesses that apply can get $10,000 within a very short period of time, just to fill the gap that is currently there. So I think from a high-level overview, Congressman, that's probably it. I think questions may be more appropriate. So I'm ready.
Okay, great. Let's jump into some questions, and we've still got a ton of questions. So what I'm going to do is we're going to do rapid rounds of questions. I may try to direct the questions to we still have a lot of healthcare questions as well, but we've got a question from John in Orangevale. John, you're on. John.
Hi, can you hear me?
I can, yeah. Go ahead.
John.
Hi, thanks for taking my call. I am a small business owner, a general contractor, and taking a little bit of a hit by staying home and looking to see what sort of assistance is available as part of the law that was just passed, and got a lot of information from the last speaker. But I don't have access to unemployment as I'm a sole proprietor, and so I think that I'm going to be looking into the Small Business Administration assistance.
Sure. Heather, do you want to take that?
Sure. John, my advice to you would be to go to SBA.gov. Right on the top of our web page is a yellow toolbar. It talks specifically about the programs that are available for the COVID-19. It's a very quick and simple application process, and within a matter of days, we will be able to get out the $10,000 emergency relief. For the rest of the request, whatever is necessary to kind of get you through this period, that will take a little bit longer. It could be up to 2 to 3 weeks, but at least that's something to fill the gap immediately. If you have any questions, you're welcome to call our office. Again, we're located right here in Citrus Heights. Our office telephone number is 916-735-1700. And
Thanks for that,
John.
Heather. Go ahead.
And actually, this is Richard Pan. I know you say that you run your own business. If you are an independent contractor, you should still try to consider applying for unemployment. So I'm not sure exactly what your status is as an owner of the business, but independent. There are some opportunities for people who are considered independent contractors for unemployment in the state.
There are, and it's in the federal bill as well. So let's we're going to be sending out those numbers, email addresses, et cetera, as well after this call and tomorrow. If you're not on our email list, go ahead and press 5, and we'll make sure we get that information to you. We've got a question from Thomas in Fair Oaks. Thomas, you're on.
Hi, this is Thomas Sloan, and I'm an organic farmer in the Sacramento and El Dorado County area. And I want to know what the small business partnership that is part of the CARE Act will do for us from the standpoint of employees that may be laid off, or besides all the sheltering in place, because that's what we've been doing. I've been listening to some of the small business information, but I'd like to see what they would do for the farming industry because of the fact that we are adversely affected at this time as well.
Yeah. I'll go ahead and take a crack at that question. I was on a call earlier today, and that exact question came up for, we have a lot of small farmers in our community and elsewhere, and historically a lot of that relief's gone out through the USDA. We've fought to actually make it part of the SBA process, and treat yourself as a small businessman, and have the ability to tap into some of that. I don't know specifically for farms if we were able to get that portion into the bill that was signed into law on Friday. Heather, do you know if you have the ability to cover small farmers?
So that's a great question, and one that's come up often just over the past couple of days. And we're working very closely with our USDA partners. Had a conference call with them yesterday. So whether it is covered under the SBA programs or a USDA program, we will have assistance for you. So again, we're trying to deploy the programs as quickly as we can, but feel free to reach out to me directly, call my office, and we can walk you through that process.
Actually, this is Richard Chan. I understand that there was in the federal bills $9.5 billion to assess specialty crop producers and producers support local food systems such as farmers market, schools, and restaurants, and livestock producers, including dairy. So I don't know if you fit in any of those categories.
Great. Thanks, Richard. The other thing, let's just talk about how the bill was structured. We fought pretty hard for small businesses and nonprofits to get grant funding, understanding that as your businesses are closed, many businesses already have debt. So if it comes in the form of a loan, that doesn't necessarily help you. It just adds more debt to you. The way most of this bill is structured is to try to keep people employed. So, these will come out in the form of a loan, but if you keep folks on your payroll, keep them employed, and some of this will be retroactive, you will have the ability over time to forgive a portion or all of that loan based on what portion of your workforce you're able to keep employed. And again, the intent there is we don't want folks to go on unemployment. We'd like them to continue to have jobs, and if we can help offset the payroll costs of small businesses and keep those folks employed, the thought is that when we do come out of this, we'll more quickly be able to reopen and get going again. So, we're doing everything that we can, and I suspect we're going to have to do more. That, we probably will have to do a fourth stimulus package. And that is starting to be debated right now. We've got a question from
Can I quickly just
Michelle
mention the California Department of Food and Agriculture has a website, so for people or farmers. Thanks.
Great. Thanks. And we've got a ton of questions to get through here, so let's keep the questions short and let's keep the answers short. We've got a question from Michelle in Elk Grove. Michelle, you're on.
Hi. Thank you for taking my question. I'm very concerned about people being able to pay their rent or mortgage, and it's coming up due tomorrow in the next few days. And I haven't heard anything concerning a pause or moratorium on people having to do this, pay their rent or mortgage. And I'm concerned that we're going to have a huge homeless population once COVID-19 is done.
Michelle, thanks for your question. Both the city of Sacramento and the county have eviction moratoriums now. The governor has also put in an eviction moratorium, and in this bill we were able to put in a federal eviction moratorium as well as funding for rental housing assistance. So, we understand that April 1st is tomorrow, and a lot of people's rents are due, and if you don't have that paycheck, you're not going to be able to make that rent. And the last thing we want is for folks to be evicted. So both at the local level, the county and state level, and now at the federal level, that eviction moratorium should be in place. And again, at the federal level, we're trying quickly to push out rental housing assistance. So.
And actually, thank you. And also, I should mention, because you mentioned mortgage payments, the governor of in California has gotten agreements from most of the major lenders to provide up to 3 months. Bank of America said they'll do a month at a time, but the other one said 3 months of mortgage deferral, so you still owe the money, but you don't have to pay it right away. So please check with your bank about a mortgage deferral here in California.
Great. We're going to go to the next question, which is a healthcare question. Donna from Citrus Heights, are you still on?
Yes, hello,
Donna?
Congressman.
Yeah,
Barry?
hi, Donna.
Hi. There was some watching the news day in and day out. There's been some questions about face masks, and I know they're in short supply, but I actually have some that I wanted to know if you recommend those that have them to use them when they go out to go to the grocery store or fill their car up with gas or doing what is necessary to wear one. And I am in that age bracket where I'm probably more vulnerable than,
Are you talking about surgical masks?
Peter, do you want to take that?
Mm-hmm. Yeah.
Actually, the newest guidelines coming out from CDC are probably that they actually do more good than harm, so they are probably beneficial. Particularly, they may reduce the amount of aerosolization. That doesn't mean you should reduce your social distancing. You should continue to do social distancing, but it's probably a decent idea to wear them.
Great. Thanks, Peter. Let's get to the next question. We've got a question from Carol in Sacramento. Carol, you're on. Carol, are you still there? Carol.
Hello.
From Hi, Carol. You're on.
Hi. Actually, I'm in Elk Grove.
Okay.
My question is somewhat of a political nature. I am glued to the news probably more than is healthy. And my question is more specifically about the availability of ventilators, of PPE, of anything else that falls under the heading of necessary equipment for the medical profession to have available to them. And the president continues to suggest that all of this is, readily available simply by putting in a request for it. And several governors have made it abundantly clear that they're in bidding wars for the equipment, which is not readily available. And so I guess my question is there any effort behind the scenes to rein him in and get the Defense Production Act fully implemented and see to it that people who know more about providing health care are put in charge of this particular matter?
Right. Carol, thank you for that question. It's almost a daily occurrence that we as members of Congress are pushing the president to use the full powers in his authority in the Defense Production Act to compel companies to make these ventilators. You have companies around the country that can make low-cost ventilators, and you want to make sure that they're filling the needs of Americans and not trying to profit here. So we're certainly pushing that to make those plans and et cetera available. I've talked to the chancellor over at UC Davis. They've got a special COVID-19 task force that they've got great engineers and others that are ready and willing to start solving some of these issues. The first thing is the president really does need kind of a supply czar, someone who can keep track of all the inventory, what's available around the country, and distribute that to the hot spots. If it's 50 states competing against one another, and there aren't enough ventilators, there aren't enough protective equipment, then it's going to be very discoordinated. We also know that different parts of the country are going to get hit harder first, and then potentially recover first. And if we can send equipment to those hard hit places as maybe New York starts to recover, but California starts to get hit, we have to have a system where we can quickly ship the equipment where they need. But under no guise, regardless of what the president says, we don't have enough ventilators, we don't have enough protective equipment. We have to continue to to replenish those supplies and produce that equipment, but we also, have to make sure those supplies get where they need. I know, Richard, do you want to say something about what the state's doing, and then maybe Peter, what we're doing here locally for supplies?
Sure. Yes. So here in California, we are working to try to get that equipment. I would just go back to what I said at the very beginning. Our best frontline thing to do in terms of these supplies is actually for everybody to practice physical distancing and to slow the spread of this disease. That will reduce the demand on our healthcare system for hospital beds, ventilators, PPE, healthcare workers, right? So far, I want to thank everyone here in the Sacramento community. It looks like we are doing it. Now, we still have to work to get more of these supplies, and we need the President's leadership, and he's the only one with the authority. He's the only one who actually has the authority to be able to have more domestic production so we can have a more reliable supply of all the things that we need. But barring the President's acting, all of us acting on our own to slow the spread of this disease is what's going to allow us to get through this.
Great. Peter, do you want to add anything about supplies?
No, I think in the interest of time, we should go on.
Okay, great. We have a question from Marnie. You have a question?
I do. Thank you. I see a lot on about health cares and what they're doing. I don't see a lot about our VA hospitals and patients they're taking in and what they're contributing to care. Can you address that?
Sure, absolutely. We've been in close contact with the VA. They have really been, preparing as well, because they do take care of an older and more vulnerable population. So, what they're doing is creating that same capacity, doing the social distancing, and potentially getting ready for a wave that they may see coming up. I know I've got a call tomorrow or the next day with VA Medical Director David Stockwell to get a sense of what's going on there. But thus far, I think they're doing okay, and our local VA is certainly being prepared. And I think that at the national level, all the VAs are taking the same preparation measures as any other hospital, knowing that they could see an onslaught of patients. This isn't a question that I see, but I think it's something that I get asked a lot. And Peter, maybe you could answer this.
Okay.
People have said, if we're going to see a wave, when do we think we might see that wave? And, how long do you think we'll have this stay-at-home order? Do you want to take a crack at that?
Yeah, so as the Senator Pan has been saying and the Congressman has been saying, we've done a very good job in California. We have a rating of an A in these models that have been done in terms of reducing the amount of social contact we've had. And that's clearly made a difference in terms of flattening the curve. And from what I've seen from the simulations that have been presented from people like Gates and the Gates Foundation, actually we probably will, if things continue as they are and we're continuing to do the social distancing, we will probably avoid a surge capacity that's going to be over the capacity of what our hospitals have. In other words, we probably will have enough beds and ICUs. We may need some ventilators, as Senator Pan was saying, which we're going after. But the key is to try to keep the social distancing. And the estimate is now that our peak would occur somewhere around the week of April 22nd to 26th and last for a couple of weeks, 3 weeks, and then head back down. But again, we are doing a good job of flattening the curve. If I could put out one message, as the senators have been putting out all along, it is that if you can just tweak the social distancing we're doing, if instead of going out to the grocery store twice a week, you go once every 2 weeks and don't hoard. If you work for a business that is essential, that didn't let you work from home initially, but now you can work from home, work from home. So try and do as much social distancing as possible.
Great. Thanks for that, Peter. Let's get to another question. We've got a question from Megan in Sacramento. Megan, you're on.
Hi, I was just curious what financial relief efforts are being made to assist those that are self-employed. Are there any special grants, anything like that?
Absolutely.
Heather, do you want to take that?
Yes. So the economic injury disaster loan is for those self-employed and small business owners who have had an economic impact due to the coronavirus or COVID-19. With that said, the payroll protection program wouldn't necessarily be applicable to you if you're just a single person or a sole proprietor, but it could be. So we have a lot of latitude within these two programs, and of course we want to do what's best for you, being the small business. With the payroll protection program, it's only a 2-year term. With the economic injury disaster loan, is a 30-year term. So with the longer term, it provides for lower payments, but it does require a payment. Payroll protection program, however, if you can document that it is saving employees and not having to lay off, that portion of the loan is then forgivable. So if you'd like to call my office, we'd be happy to talk to you about that.
Great. Thanks, Heather. Let's get to another question. We've got a question from Linda and Carmichael. Linda, you're on.
Thank you. First of all, I want to thank you, Congressman Bera, and your accompanying guests for being so caring for our community. My question is, I'm concerned about surfaces and how long the virus lasts on surfaces. I've heard plastic 3 days, cardboard 1 day, porous, non-porous. I've heard a lot of different information, and I wonder if there's any accurate information about that.
Peter, do you want to take that? Peter?
Or I could try.
All right, I was off.
Oh, there you are.
Mute.
Okay.
There are a bunch of studies that have shown that the virus exists for a period of time on a variety of surfaces, which are called fomites. Those are things like handrails, etc. However, the virus degrades very rapidly, particularly in warm weather. Not per what Trump is saying, but it does degrade in warm weather, and it is very unlikely that most, if any, cases have occurred due to the spread through fomites. That being said, I would still wash my hands after touching the doorknob or of a building or a elevator button or things like that. But you should be relatively assured that that's not a very good way of getting the virus.
Great. Thanks for that. We've got a question from Steve in Citrus Heights. Steve, are you on? Okay, oops. Looks like Steve's no longer there. We've got a question from Steve in Folsom. Steve, are you on?
Yes, I'm here.
Great.
First, I have two-part question here. First of all, and this is kind of a follow-up from an earlier question about PPEs and seeing what New York's been through. Is there been any effort to incentivize local industries to produce PPEs?
Yeah, some local industries have actually just stepped up on their own. We've had distilleries here that have shifted over and are making hand sanitizer, and we've been connecting them with the hospitals, the community clinics, the first responders, and that's certainly been helpful. Others who are manufacturers and others are stepping up to try to figure out how they can help. We don't have garment makers here, but I know a call has gone out to garment makers to see if they could switch production to create some of the PPEs and so forth. But this is where I as a congressman, Richard Pan, as a state senator, we don't have the ability to compel those companies to do that. Only the President of the United States has that ability through the Defense Production Act to say, here's a need, we need you to stop what you're doing now and start doing this in the sake of national security and national health. So, that has been a constant message to the President that we'd actually like him to use his full powers.
And actually, this is Richard Pan. There are a couple of manufacturers, I think Gap, and there's another manufacturer that says they're going to manufacture gowns. So we are using persuasion. There are people working on ventilators and so forth, but we do need the President to step up so we can get appropriate supply and also help us manage the logistics as well, how to move this product to different parts of the country.
Great. Thanks for that question. We are now just a little over an hour. I always want to be respectful of folks' time. A couple things. If we don't get to your question, we're going to take maybe one or two more questions. Stay on the line. Leave us a voicemail message. You'll be automatically connected to voicemail. And leave your contact information, your email address, phone number, and I will make sure my staff either gets back to you directly or connects you with a person who can answer your question. So again, if we don't get to your question, just make sure that you stay on the line. We've got a question from Mike. Mike, you're on. Mike, are you there?
Yeah, hi. Thank you for hosting the call this afternoon. And I know there's a lot around what we need to be doing, that the whole state is doing and the federal government is doing to prevent the spread. And that's all critical. I get it. I'm in healthcare. Secondary to that, there must be some discussions, at least preliminary discussions, around how we're going to phase back in the restarting of the economy. And I'd love to hear what those discussions may be shaping up to be. Is there a phase and approach strategy to bringing the economy back online?
Sure. Mike, thanks for that question. So we've, at the congressional level, we've been having conversations with healthcare experts and others really thinking about this. And you'll hear Dr. Fauci and Dr. Birx talk about it as well. Again, I think Dr. Bielenson talked about this potential wave in Sacramento in the second or third week of April, and then maybe a couple weeks beyond that. So we want to make sure we're using the data to make sure we're being safe before we start trying to get back to work. So at the federal level, what that means is, can we do disease surveillance? Can we do serologic testing to get a sense of how many people in a community have been exposed to the virus, have some level of immunity? And that's going to be really important. So quickly ramping up the availability of serologic tests. We've already developed the test, in labs. Now we have to make sure the FDA approves it quickly and the commercial sector can ramp that up. It likely will be, it's a blood test, but it likely will be a finger stick blood test. How do you distribute that through the community and get the results back so you have a good sense of the level of immunity in a community? The second piece is we still have to have enough diagnostic tests, because we do think as you start to reopen, you still will see, the virus won't disappear by staying at home, but you may see pockets of outbreaks, and you have to do real quick contact tracing. So can you get out there? Can you test the person who now is showing symptoms if they have the disease, and quickly try to isolate the clusters as they pop up around the country? And then thirdly, you heard Dr. Fauci a little bit today talk about whether as we start to open up communities, should we be wearing face masks potentially to reduce the risk of a recurrence or a second surge? The data does seem to be moving in the direction where face masks actually may show some benefit, as Dr. Bielenson suggested, in reducing the transmission. And then the fourth thing is we know this virus affects different populations differently. That, for the most part, not in all cases, but for the most part, folks under 50 are getting infected. Some folks are getting really sick. Some folks are ending up on ventilators, but the vast majority have mild symptoms or are asymptomatic and are recovering. They may be at relatively low risk. That said, we know there's high-risk populations, those over 60, and particularly those over 70 and 80, where, if we look at the data, you're really seeing some devastating illness. We may have to treat that population slightly differently until we actually have good therapies and treatments, as well as, maybe, 10 months, 12 months until we get a vaccine, maybe even longer, until we have that gold standard treatment. I don't know, Dr. Bielenson, do you want to add something there?
No, I think you're right.
Great.
Can I just,
yeah, please.
And thank you, Dr. Bear. I think you outlined very much the scenario, which basically means if you're going to just talking about masks, if we need a much greater supply of them then, so then people in the general public can wear them. That will actually reduce transmission from someone who's sick, who may be asymptomatic. And then the testing. Again, this is a supply chain issue, or tests are limited, not because of we've had trouble with reagents, with swabs, transport media. So this goes back down to actually logistics and getting the supplies of the things we need out there, and that's why we need the president to step up so we can move to this other phase eventually.
Great. Let's stop with that. I'm just going to make a couple closing comments. First off, I want to thank Heather Luzzi from the Small Business Administration, Dr. Bielenson. You're doing a great job protecting our community, and Dr. Pan, obviously you're doing a great job both as a doctor and representing us at the state level. A few parting messages. We're all in this together. This is not a virus that knows if you're a Democrat or a Republican or what culture you're from, what religion you practice, whether you're in a red state or blue state. This is a virus that's going to impact every community, every state, and the entire planet. And now's the time, if we look after one another, if we come together as a community, the things that we can do, both Dr. Bielenson and Dr. Pan mentioned it multiple times, the one thing we actually can do to help defeat this virus right now is stay at home and do the social distancing for the time being. And if we look after one another, if you have neighbors that are particularly vulnerable, helping them out as they can, it's probably prudent for them to stay home and maybe send your college-age kid to the grocery store to pick up those groceries for them. We've got to protect that population as well that's particularly vulnerable. And then when it is safe and the data indicates that we can start opening up portions of our community, and that'll come from the doctors and the scientists, we also have to be in this together. Those of us that have more will have to do more. If, as Heather said, if you can order takeout meals and pick those up to just try to help some of these small businesses get through, that's great. But as we start to open up, we're all in this together, and it will be a different world, a different community. But if we are in this together as Sacramentans, as Americans, and as people who inhabit the planet together, we will come out of this hopefully in a kinder, gentler place and relieve some of the divisiveness that we've seen in this country. So if we did not get to your call, please do stay on the call. You'll get a chance to leave a voicemail, leave your name, a number, an email address, and we will certainly get back to you and try to answer your question. If you'd like to be on our email list, go ahead and press 5 right now, and we will also send out information that was on this call. Alternatively, you can go to our website at BERA, B-E-R-A, .house.gov. Again, thank you for spending some time with us this evening. We will continue pushing information out. We will continue to have these telephone town halls. God bless all of you, and let's be safe, let's be kind to one another, and let's be well. Thank you, and have a good night.